All right, we are going to talk sciatica. A lot of my clients come to me with sciatica, and it's a problem. Lots of pain. Sciatica is pain going from the back to the leg. Sometimes the pain is only felt in the leg, and sometimes the pain is felt in the back, shooting down the leg. And that pain normally will go into one leg. If we have shooting pain into both legs, that can be a medical emergency, and we will have those patients go to the emergency room. So shooting pain both legs can be a problem that is more extensive than chiropractors will deal with. Sometimes the pain will go to opposite legs. It'll alternate, but usually it's in one leg. And when we have our history with our client, we want to know exactly where that pain is. All right. So when we're looking at the schematic here, these are the pelvises. This is the sacrum, the bone that sits between the pelvises. This is the hip joint. This is the femur, the big leg bone. All right. Chiropractors, we want all of this to be level. All right. If this is crooked, if one pelvis or one hip is higher than the other, this is kind of our base. The sacrum is our base. All these bones will predicate how that sacrum is situated. If any of these are crooked, then the sacrum can tilt and the spine is sitting on a crooked base. Then that's going to lead to, eventually, it's going to cause sciatica. All right. That's going to get our patient into our office thinking we need to get this handled. I can't deal with this anymore. All right. So these are the vertebrae. Most people have 5 lumbar vertebrae. This is the lowest one, the 5th lumbar. Some people have 6, some people have 4, but it's not common. So the 5th, the 4th, the 3rd, the 2nd. And how our body works is this is hollow. Inside of this is the spinal cord. All right. And then nerves will exit out between every set of bone. And this space between the bones is our disc. Sometimes that disc will do what's called herniation. It comes out of its proper position and it can impinge upon the nerve that's going down. These nerves go down to different parts of the leg. So this L5, S1 vertebrae, L5, this is sacrum. That nerve goes down the back of the leg. This L4, L5 nerve goes down the side of the leg. Now this is predominant. Sometimes we have what's called congenital anomalies where the nerve doesn't go the standard place. But this is almost always what happens, how the body is situated. And then L3, L4, that nerve goes down the front of the leg. Now, as well as going to the nerves, this L3, L4 goes to the ovaries and the prostate. So when, for example, when a woman's having prostate or ovarian trouble, they will have sometimes an ache in the front upper thigh. Okay, it's the same nerve going to the ovary that goes to the front of the leg. All right, somebody comes to us with upper thigh pain. That's not the common sciatica. We oftentimes will refer them out to an OB/GYN doctor to get all that checked out. Okay. All right. So chiropractors, we want to see all of this stuff level, because if it's not level, muscles that attach into bone can spasm, nerves can get irritated, inflamed. All right. Sometimes the disc is involved where it's herniated. And in some cases, that ends up being a surgical case where the surgeon is going to maybe fuse these bones together, although that's done less than it used to be. Sometimes they excise the disc. They do what's called a discectomy, where they take the disc out. Our clients, most of humanity should be seeing a chiropractor before they do surgery or they contemplate surgery, because a lot of times chiropractors can get this resolved. Okay, Sometimes they don't, and then it ends up being a surgery. Why would you do that as a first option? You would do it as your last option after you've figured out that maybe chiropractic isn't going to work for that. Okay. All right. So when I do my scan on patients, when I do my exam, I'm checking to see if their hips are straight, if their pelvises are straight. This is the pubic bone area here. Sometimes the pubic bone is out of place. I just had a patient today who came to me, his pubic bone was out. He had been a swimmer and had done breaststroke, where you do frog kicking. And he had done that a long time ago, high school. And now he's lifting weights, doing squats and whatever, accentuating his problem. He's fortunate he didn't have a real acute issue. We found his pubic bone was wrong. The pubic bone is a centering mechanism. If that's wrong, that can disrupt everything that sits around it. So we don't just want to be checking to see if these vertebrae are straight. We want to know if the pelvises are right, the hips are right, the pubic bone is right, the sacrum is right. All of those have got to be right as well as the spinal vertebrae. Or else I could just adjust the spinal vertebrae. If these are wrong, that patient's going to have continued issues. They might feel better for a little while, and then the problem comes back. And the patient's going, oh, you know, the doctor adjusted my spine where that nerve is being pitched, or that muscle spasm. How come it's back so soon? Well, possibly this pelvic, hip, pubic bone, sacrum area wasn't corrected and stabilized. And there can be a process of doing that. You wouldn't go to an orthodontist and expect him to say, Doc, you know, I just feel like getting my teeth straight in one go. He would laugh at you and kick you out of the office and say, come back when you got 12 to 18 months worth of time to get things settled into place, right? All right, so this is the gist of sciatic pain and back pain, which we see all the time. Thousands of patients I've seen with this issue.